Hey everyone, we're back with another specimen. This is number 848 in our collection. The heart would have sat roughly in the chest like this, with the anterior surface coming out towards the screen, posterior surface towards the turntable, inferior legs down here, superior head up here, left over here, right over here. We'll start off as we usually do, which is by trying to identify at least what externally looks like the morphologic right atrial appendage. And here we see an appendage that's triangular in shape, pyramidal, or broad-based, consistent with, at least externally, a morphologic right atrium. So why don't we go ahead and open up this atrial appendage here and take a look. And what we find is that there are pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. See that the oval fossa is intact. And then we do find the mouth of the coronary sinus here. And then here is the tendon of Totaro. And whenever we speak about the tendon of Totaro and the mouth of the coronary sinus, we know that these are two of the three structures that form the triangle of Koch, with the third structure being the right-sided atrioventricular valve. And so here's the right-sided atrioventricular valve. If we form our triangle of Koch here, the apex would be here, and this is where we would expect the atrioventricular node to be in this heart. When we look at the right-sided atrioventricular junction, we do find that it's guarded by a right-sided atrioventricular valve that has three leaflets. 1, 2, 3. There are direct septal connections between this valve and the ventricular septum, all consistent with the morphologic tricuspid valve. This ventricle here has coarse trabeculations, and there is a septomarginal trabeculation consistent with a morphologic right ventricle. When we get into the right ventricular outflow tract here, we do come across our first arterial or semilunar valve. As we always point out, the arterial valves don't have a true round or oval annulus. It's actually a crown-shaped annulus, as the fibrous valvar leaflets do have these triangles of myocardium that interpose, these interleaflet triangles. This valve is entirely supported by muscle here, has three leaflets, 1, 2, 3, with three sinuses, and no coronary arteries arising from within the sinuses, all consistent with the morphologic pulmonary valve. Here's the pulmonary trunk, and we do see the branched pulmonary arteries arising from this. One thing I did fail to point out before, and before we get to the other side of the heart, just wanted to note, here is the superior caval vein draining into the roof of the right atrium. We can take a look at exactly where that drains. So here is the superior caval vein, and here's its drainage point into the roof of the right atrium. Now let's go ahead and flip this heart over. And when we flip it over, we do find that the left-sided structures appear a little smaller. Here's the left atrial appendage. Let's go ahead and open up this atrium here. It's a smooth-walled atrium, consistent with the morphologic left atrium, and we see that all the pectinate muscles are confined within the appendage here. Now, right off the bat, we do see that this left atrium is abnormal. It is, in fact, divided by a membrane here. You can see this membrane has been opened up, but I've sutured it back together to kind of demonstrate how this membrane would have sat normally. So here we do have a divided left atrium, what some would like to call cor triatriatum, but let's stick with English. So here is the divided left atrium. Has two components. There's a pulmonary venous component, which is right through this orifice here, or we can also see it from the top here. And there is a vestibular component here. And the vestibular component has the oval fossa, as well as the mouth of the left atrial appendage. Here you can see the orifice that helps drain the pulmonary venous component of the left atrium. And you can see that this membrane does stop short of the mitral valve here. But why don't we move this heart a little bit, and let's take a look at it from here. Here we see the pulmonary veins draining back. And here now we're looking down at the pulmonary venous component of the divided left atrium. This component then drains through this orifice to the left atrium. All right, so the pulmonary veins come back to a chamber that is created in the left atrium by this membrane, then drains through a perforation in that membrane into the left atrium. And then here is the left-sided atrioventricular junction. You can see it's guarded by an atrioventricular valve that has 2 leaflets. There are no direct septal connections of this atrioventricular valve, consistent with a morphologic mitral valve. Okay, and here's the anterior leaflet, here's the posterior leaflet, and then this ventricle here has fine crisscross trabeculations consistent with a morphologic left ventricle. And you can see right off the bat that this in fact looks much smaller than the right ventricle. So here's the right ventricle, and then we flip this over and here's the left ventricle, which is significantly smaller, which you can presume clinically might be due to some sort of obstruction at the level of the left atrial membrane here. Now when we get into the left ventricular outflow tract, we find another arterial valve, once again with a crown-shaped annulus, as it does have fibrous valvar leaflets with interleaflet triangles. Unlike the pulmonary valve, this aortic valve does have partial fibrous support, as there is continuity, fibrous continuity between the anterior leaflet of the mitral valve and part of the aortic valve. We do see a coronary artery here arising from within the sinus of the aortic valve. And then here is the ascending aorta. So once again, why don't we just highlight the defining feature of this heart, which is this divided left atrium. Here is the actual membrane itself. Here is the orifice between the pulmonary venous component that allows blood to drain from the pulmonary veins back to the left-sided atrium. Here is the vestibular component of the divided left atrium, which has the oval fossa, which is intact, as well as the mouth of the left atrial appendage. And then here's the membrane again. Here's kind of where it ends, and here is the mitral valve apparatus. So a heart with a divided left atrium.